CURES is sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.
Helping you lead a healthier life. This is CURES.
Hi, everyone. We're back now with a new CURES show where we explore the cutting edge of wellness from credible sources. I'm Kara Sundlin, and we are continuing a conversation we've been having on this show about GLP-1s. You can refer to a prior episode as we talk about how these are being used and even some holistic hacks if you'd rather try that first. But for those of you who are already using a GLP-1 drug or think maybe you want to use them, maybe you want to try microdosing, something that's being talked about a lot, we're going to get into all of it. And joining us now to talk more about this is someone I'm very excited to talk to, Dr. Maria Teresa Anton. She is an endocrinologist, also an educator at Pritikin Longevity Center. We want to thank you for being with us so we can get some credible information here.
Thank you for having me today.
Yeah, so, I mean, this has been an explosion, has it not, of just so many people using GLP-1 drugs. And just in case people don't know what that is, we were talking Ozempic, Wegovy, and then, of course, the generic forms of those.
Correct. So yeah, there's been a huge explosion in use of these medications. We're seeing that these have been a fantastic tool for patients that are diabetic and had, were struggling to manage their blood sugar. We're seeing the use for weight management as well. And we're finding that there are so many other potential uses for these medications, maybe in the arena of PCOS, potentially for joint pain, sleep apnea. So it's really exciting.
Yeah, I mean, it's interesting that you say that. It's really exciting because I think some people are just immediately like, no, that's cheating or that's scary or you're hurting yourself. Is the feeling changing that this could actually be really good for people if it's done right?
Correct. So I think that you made a great point when it's done correctly. So it's always going to come down to a conversation with your doctor about what your own personal health goals are and whether this is the appropriate tool to use for that. So we always will talk to the patient, explore their underlying medical conditions and what their own personalized health goals are before we even suggest, potentially beginning one of these medications.
Yeah. So you support microdosing of GLP-1s, or maybe people are taking a regular dose. Let's just talk about what that is. If you're on Instagram, especially if you're looking for information on perimenopause and menopause, you're seeing all these people who look amazing and say that microdosing a GLP-1 has been the game changer for them, even if they were doing everything right. Do you think that's the case, that can be true?
So I think for the right patient, it might be. We know from these medications, they were extensively studied, and the doses that are recommended right now are truly the therapeutic doses that they found were going to achieve the weight loss, were going to achieve the improvements in the blood sugar. Now, that's not to say that microdosing doesn't have a role. We know that certain patients can't tolerate the full dose of the medication, or maybe because of cost barriers, patients were also trying the microdosing and finding that they were doing well, maintaining the weight loss on that lower dose. So it certainly has a role to play. Unfortunately, we just don't have a lot of research to back it up right now.
Right. Okay. So first of all, let's back up to basics. People are throwing the term GLP-1 around. Maybe you're, what is that? Most people know what Ozempic is. So what is a GLP-1 and why does it help you lose weight?
So these are medications that are mimicking a hormone that we all produce naturally from our gut. It's called GLP-1. And these medications actually have an extended life in our system when taken via this medication. The GLP-1 that we all naturally produce, it's broken down extremely quickly. But we do know that it plays an important role in the way that our body manages blood sugar. So these medications actually work in the brain to help decrease our appetite. It works in the gut to slow down digestion and keep food in the stomach for longer so that you actually feel fuller longer. It also works in the pancreas by helping with the insulin secretion, and it helps with the insulin sensitivity so that your cells can actually respond better to the insulin that you're making. So it's working in all these different places to not only regulate your blood sugar, but also have the side effect of weight loss because of the appetite reduction and just your body working better.
Now, a lot of people understand that these are drugs for people who are pre-diabetic or diabetic. But there's all these people who say they're taking them who are not these things. And maybe they're insulin sensitive, or my co-host who said, he really wanted to finally lose the 40 pounds, which he's basically done because this quieted all the food noise for him. What do you think about people taking it who are not diabetic or don't have a high A1C?
Yeah, I mean, we still have a lot of research to do and, on a specific role in patients outside of the diabetic or obese range. And I feel like it probably does have a benefit. We see it all the time in our patients that are using lower doses. Unfortunately, it's not FDA cleared in that manner. So it really is still an off-label use to do the microdosing. But that's not to say that it doesn't have potentially a positive impact.
So, some people might be saying, oh, it's not FDA cleared. Can you explain, does that make it more dangerous, or they just haven't studied it that way?
Yeah, so these medications were extensively studied. What we don't know is about its therapeutic value at this point with the microdosing.
So there's not more danger by using a microdose, like a less dose. And maybe talk to us
Correct.
about that. Like, what is microdosing? If a normal dose is
Yeah.
X, what's microdosing?
Yeah, so there is a standard of care that is considered the normal therapeutic doses, right? For Ozempic, we usually start at 0.25 milligrams per week. For Manjaro, we would start at 2.5 milligrams per week. Those are considered, starting therapeutic doses. Microdosing is actually using a much lower dose than that. So whether you are using a pen that involves clicking up to the dose and using less of the clicks than recommended, or using a vial and drawing up less of the medication than what was prescribed, that would be considered microdosing.
Well, and also some people are doing it with just the peptide, right? We're hearing that if you go on Instagram, there's all these people coaching saying comment peptide. They're just using, I guess, the base ingredient, semaglutide or tirzepatide. So it's not really the brand name medication, right? Can you
Yeah.
explain that to us?
So I would not recommend compounded formulations, which I think is what you're referring to. These compounded formulations are created by individualized pharmacies. We don't have any safety or efficacy data on these compounded formulations. So I really advise my patients to stick to the FDA approved medications and to not experiment with these compounded formulations that may or may not give them the desired results.
Okay, so just if you're wondering what's compounded, we do have some, I guess, very respected compounding pharmacies here in Connecticut. But if you're going online, you might be seeing that you can join these programs by big companies like Hims or Hers. And those, they say they're so much more affordable, which is, I think, maybe why people are doing it. That means it's probably coming from a compounded pharmacy. And what does that mean?
So when it's coming from a compounded pharmacy, it means that they are actually creating this medication. Um, the FDA is not involved in the production of that compounded formulation. And so that's why we know that there might be issues either with the safety or the efficacy of that compounded variety.
Okay, not quite as rigidly tested or known.
Correct.
Okay.
Exactly.
So let's move on to perimenopause and menopause, okay? This is a
Yeah.
time when women out of nowhere might not even realize. I think people are becoming much more aware of hormone changes in perimenopause, years before menopause, maybe in your 40s or after 35, and then certainly in menopause where they're thinking, gosh, I'm doing all the same things and I just all of a sudden gained weight. And so they're interested in using a microdose of a GLP-1 or maybe even a real dose. Do you think this is good for women who are struggling right with weight gain and they don't know why?
Yeah, potentially. We know that the symptoms of, perimenopause, menopause, these symptoms can start up to 10 years before actual menopause. And the average age of menopause is around 51 for women in the United States. So all throughout women's 40s, they might be starting to experience some weight gain that's unexplained. They haven't changed their diet, they haven't changed their exercise routine, but yet they are storing fat in different places, more along the midsection. Maybe they're feeling more tired, and maybe even noticing changes in the blood work. Maybe their cholesterol numbers are coming up. Maybe they're seeing an increase in their hemoglobin A1C and overall blood sugar trends. So absolutely, these medications can certainly play a role in helping women get through this transition period, help with some weight loss if they've really optimized what they can do in terms of lifestyle and are not seeing the types of results that they're looking for, and also many times help with the changes in the blood work, right? We know that the weight loss can certainly improve all of their numbers there.
Okay, so there's where the lifestyle comes in. There may be, especially in the early rounds, a lot of people who went on GLP-1s at a microdose or a real dose. They ended up things all over the internet, the Ozempic face,
Yeah.
sometimes some serious things, going to the emergency room for
Um,
different things. What have we learned? What do you stress to your patients about how to do this right so that you end up healthy?
Yeah, so the most important thing that we have to emphasize is that this medication is just a tool. It's not going to replace the lifestyle changes that are still necessary. With this medication or with any type of rapid weight loss, we can see a loss of lean muscle mass in addition to the body fat loss. So it's really important that we, emphasize to our patients that they need to be increasing their protein intake and developing that better relationship with food, in addition to incorporating strength training, which is going to allow their body to retain more of that lean muscle mass.
How much strength training? Like if women are on this right now and they're thinking, well, I'm losing all this weight. I mean, there's some
Yeah,
danger because you probably don't want to be in it for your whole life and you don't want to end up with muscle wasting that could put you on a walker
correct.
down the road.
Yep, absolutely. So generally, I'll recommend about 2 to 3 times a week, depending on what works for people's schedules. And that's generally enough. If you're really challenging yourself, working on the progressive overload, challenging your body, I think that should be sufficient.
So, for some people who haven't worked out with weights, and especially the generation that's using it, they might have just been like cardio queens. The
Yeah.
strength training is very important, right? Do you have to use really
Yes,
heavy weight
absolutely.
or maybe take a hit class? Could you do it with
So,
just body weight?
yeah, if you're starting from scratch, I would recommend to start with the body weight movements. From there, once you get comfortable and you're feeling stronger, you can start to incorporate maybe some dumbbells. Machine work is also really safe for the most part, and it allows for you to gradually increase the difficulty as tolerated.
What would you say to women or men who are on these GLP-1s, but they're not strength training at all?
There is a real risk of losing your lean muscle mass to the point where your body composition can actually end up in a worse place than it was before. We see it in the patients that were using these medications early on and maybe weren't receiving the appropriate counseling, maybe weren't incorporating that higher protein diet and strength training into their lifestyle. They were losing a lot of weight. But when they stopped the medication, we have to remember that many of the patients that stop these medications regain the weight. And so
Mm.
when they were regaining the weight, they were regaining primarily fat. And so their body composition was actually in a worse place than it was prior to taking the medication because of the loss of that muscle mass.
And that's why so many people might want to stay on these drugs. Some people say they
Mhm.
might stay on it for their whole life. Is that a good idea?
Yeah. So it depends what we're treating, but we are seeing obesity more of as a chronic condition that requires a chronic solution. And so for some patients that are managing their weight with these medications, it might be appropriate for them to be on the medication lifelong. Now, that's not to say that everybody is going to need to stay on it lifelong, but it's going to involve conversation with your doctor and identifying what your goals are and what your body needs.
Okay. So at Pritkin, you've got the all everybody under one roof, world class amenities. People might go there and actually get a whole workup. How are you measuring if people are losing muscle, or how can people know if they're wasting?
Yeah, so we actually do a body composition scan on every single person that comes in. So it's a fantastic way to obtain a baseline measurement of how much of your body is comprised of fat versus lean muscle mass. And that way we can continue to monitor, if you come back in a year or in 6 months and want to see how your progress is going, then we can repeat that body composition scan and we'll have it for comparison.
Okay, so if people are interested in going and call it a health camp and actually going in with the Pritikin Longevity Center down in Miami, Florida, you could actually go and stay there, have a whole workup. For some people, that might
Correct.
not be accessible. What would you advise people to be doing to make sure if someone just gave them a prescription and said, see you in 6 months, we now know that's not safe. So what would you tell people to do to make sure they're doing this correctly?
So, number one is identifying your own response to the medication. If you're having any side effects to the medication, it's definitely something that you need to communicate to your doctor so that they can potentially either advise you about dietary changes, because most of these side effects are going to be GI side effects like nausea, diarrhea, constipation. A lot of what we do here at Pritikin is, diet focused. And
Mm.
so our diet is actually very complementary to the use of these GLP-1 medications in that it's very low fat, low salt, low added sugar. And so that really helps with the tolerability of these medications. And we also always have to emphasize, in addition to listening to your body, you need to be incorporating that protein intake and the strength training.
So we've talked about strength. We've talked about strength training 2 to 3 times a week. I really enjoy strength training. I'm glad that
Me too.
cardio isn't the whole thing because I've never loved cardio. So I love that people are saying that. But when it
Yeah.
comes to protein, there's a lot of confusion out there that we need to
Yeah.
have this huge amount to help
Right.
with our muscle. Um, what do you think?
So I agree that we do need to focus a little bit more on the protein. For so long, I think that, even here at Pritikin, we had a lower protein diet. And now we're really following the science that is showing us that muscle is the longevity organ. And one of the best ways to keep up that lean muscle mass is by increasing that protein intake. So I, think that if you're sitting down either with your doctor or with your nutritionist, coming up with a meal plan that is prioritizing protein is really important. The specific amount of protein will vary person to person and depending on how much exercise they're doing, and also if they're utilizing one of these GLP-1 medications. We know patients that are on these medications should certainly have a higher goal for their daily protein intake.
I've heard about 1 gram per pound of ideal
Yeah.
body weight. So
So,
let's just say you're a woman and you want to be 130
mhm,
pounds. Does that mean you're recommending 130 grams of protein?
yeah.
Okay.
If you're on a GLP-1 medication, absolutely.
Or what if you're
And it
trying to
can feel
lose?
like a full-time job getting that protein in.
Yeah, I mean, it's a lot, right? So
Yeah.
it would really mean a little bit more than making sure you have protein in every meal. I mean, it's a little bit more than like,
Yeah,
oh,
it's
okay,
really
I had an egg on an English muffin. No, it's a lot more than you're
it's
used
not
to.
enough.
Okay.
Correct.
Um,
Yeah. So incorporating at least 30 to 40 grams of protein per meal and ideally some in snacks as well.
so can I put you on the spot and ask what would that look like? Like
Yeah.
what would a 30 to 40 gram breakfast look like of protein?
Yeah, so you could ideally do maybe, an egg white omelet with vegetables. That's something that we'll do frequently here, incorporating maybe 3 to 4 eggs. You can supplement that with maybe some Greek yogurt, which is an excellent source of protein, or some cottage cheese. And sometimes even incorporating a little bit of animal protein into that, maybe some ground chicken or some salmon for some people. We don't always have to have just breakfast food at breakfast. We can incorporate even leftovers, make a great breakfast many times if it's high in protein.
Yeah, I know there's a lot of talk about making sure our breakfast is more savory so we don't spike our blood sugar and be
Correct.
hungry all day.
Exactly.
We're going to continue to some of the things you need to be doing to really make sure you're getting the most of your GLP-1 drugs and hopefully losing the weight the right way right after we hear a quick message from our sponsor.
Struggling with gambling? Wheeler Health's Better Choice program offers personalized support and treatment to help you regain control. Visit WheelerHealth.org to learn more and take the first step towards recovery today.
All right, again, I'm speaking with Dr. Maria Teresa Anton. She's an endocrinologist and an educator at Pritikin Longevity Center in Miami. This is where people will often go to really get cutting edge wellness from credible sources, which is what this show is all about. So as people are quickly getting frustrated with their weight and seeing their neighbor and everyone else lose all this weight and go, I want that. And I think people are even being more open about taking the shot.
Yes.
Do you think that this should be something that if a woman who's struggling with her weight, she's gaining 10 pounds, losing 10 pounds, the same over and over, that GLP-1s should be something they consider?
If we're starting to see the metabolic impact, so for example, blood sugar levels are increasing, cholesterol numbers are increasing, maybe they already have some plaque in the coronary arteries, those would all be great reasons to start a GLP-1.
Okay, so I'll just, I mean, I like to be an open book. I mean, I had some advanced blood work done. I don't have diabetes. I don't even have pre-diabetes, but I am more insulin resistant than some
Yeah.
doctors would want to see. In the doctor that I see, she'd like to see it lower, and my score was like 36, which she said is comparable to some people who maybe would be diabetic. So she's like, you really don't tolerate carbs well, which is probably because I'm, of that age where I'm going through that transition of women who are, so would you say to someone like that who, okay, you really need to never eat a carb, or you really need to this, or what would your advice be? Or would these medications then be like, you know what, this is what's really going to make the difference in losing that 20 pounds and in making sure the cholesterol that used to be at a great number doesn't continue to creep up?
Yeah. So first of all, I'm so happy that your doctor is actually, really prioritizing the insulin resistance because many times, unfortunately, I think it is kind of overlooked or it's seen as not so much of a problem because you're not yet within that pre-diabetic range. So I think it's great that you're being proactive about, making some changes now. In terms of the GLP-1's role, it could potentially help, but we have to remember, if you're considering this as a long-term solution, there have to be long-term changes. So whether that is still, changing that relationship with food and maybe incorporating less carbohydrates on a day-to-day basis, or changing the exercise routine, gaining some lean muscle mass to help with that metabolism. All of those are still going to be important changes if you plan on eventually coming off of these medications.
A lot of people might be going, well, I'm taking the GLP-1, but how do I even know what my muscle is? I have one of those smart scales. It tells me.
Yeah.
It may not be as good as what you have at Pritikin, but would you recommend that people be tracking their muscle and fat loss?
Yeah, I think it can certainly help because if you're not proactive about still creating and retaining your lean muscle mass, I feel like it is unfortunately easy for that muscle mass loss to occur. You really still have to stay on top of it. And if, having a hard number, whether it comes from a scale or from the body composition scans that we do, helps you really stay focused on that, then I absolutely encourage it.
So you don't want to be just weighing yourself because you might be losing a lot
Correct.
of weight quickly, but your concern would be you're losing muscle, and muscle is what
Muscle as
drives your
well.
metabolism and also keeps you able to walk and do all those things later on.
Exactly. Exactly. We want to keep you out of the nursing home.
Okay. Do we have any long-term data on what this could do to your mobility if you're on GLP-1s for a long time?
So we do have about 20 years worth of data on these medications. And I think that's a common misconception because since Ozempic only came out in about 2017, I believe, people think that it's only been around for a short period of time. But this class of medication has actually been around since 2005.
Okay.
So we have about 20 years worth of data on these medications. And one of the things that we, of course, have learned is the importance of the protein and strength training to retain that lean muscle mass. But we do know that if you are losing that lean muscle mass over time, it can lead also to issues with your bones because when we have strong muscles, we have strong bones. If we lose that muscle mass, our bone density is going to decline, and it can put us at risk of conditions like osteoporosis.
I know I do have osteoporosis in my family. I
Yeah.
feel like maybe a lot of that we can reverse if, our generations before us never strength trained, didn't really work out.
Correct.
My mom would have just walked or something. And, but I think of that, when you look at our mothers and our grandmothers who are on a walker or something and going, gosh,
Right.
we don't want that. So before we come to the end of this show, what's your warning for people? I think you've talked a lot really helpful about we need the protein, we need the strength training, and you might need help with that. Don't just do this as a Lone Ranger. But what about for people who are
Correct.
considering going on a GLP-1? Do you think some people just shouldn't because there's certain red flags you would advise your patients just no, it's not for you?
Yeah, so we do have certain contraindications, including a history of pancreatitis, because the medication can increase risk of pancreatitis. So if you've had a history of pancreatitis, which is inflammation in the pancreas, you would know if you've had it because it would keep you in the hospital for a few days. That would absolutely be a contraindication, as well as a history in yourself or even in somebody in your family of a very rare type of thyroid cancer called medullary thyroid cancer. Those would be the primary contraindications to taking these medications. Otherwise, it's always going to come down to a discussion with your doctor about what your goals are and about what your numbers are looking like in order for you guys to really determine if a GLP-1 would be beneficial.
Now, a lot of people are talking about after they get to their goal weight, coming off of the medications. What's your
Yeah.
advice for people who want to come off but not gain the weight?
Yeah, so I would never stop the medication just cold turkey. So absolutely having the conversation with your doctor, letting them know, I've reached a weight that I'm really comfortable at. My numbers are looking great. And now I would love to be able to come off the medication at some point. And as long as you are really focused on the lifestyle piece that we have been emphasizing, I think it's absolutely achievable, especially in a, tapering down of the medication dose. And that's where micro dosing might even play a role. Some patients, because of their genetics, might have more difficulty maintaining that weight loss. And so staying on that lower dose, that's not necessarily a therapeutic dose, but can still provide a lot of the benefits, might have a role there.
What I think is so important to remember is you're not losing weight because of the shot. You're losing weight because of the changes you're making, but the shot is helping you because you're not hungry as much.
Exactly.
You can just
Exactly. It's a
choose
tool.
all the
It's a
right
tool. It's not a
things.
magic drug. It is absolutely a tool in your journey to better health.
So if you did exactly the meal plan and the strength training that you want someone to do, you would lose the same weight. It's just the GLP-1 is making it easier.
So the GLP-1 does work behind the scenes in that it's allowing your body to use insulin better.
Okay.
And a lot of times when our body is not using insulin well, it can make it more difficult for us to lose weight.
Okay.
So it does have that particular aspect as well that is working behind the scenes that doesn't have anything to do with the appetite suppression or the feeling of fullness that is also allowing your body to likely process carbohydrates better.
I know that at Pritikin, you guys are mostly dealing with heavily researched, FDA approved things. That's why you're not going to, I know you don't advise the compounding. The FDA has also come out to say that. I'm wondering, do you have any
Mhm.
opinions or is it something you delved into? We have done some holistic hacks here of people instead starting with Akkermansia probiotics and berberine and things, more natural supplements to help them feel full or to help increase GLP-1 naturally. Do you have any advice on that, or it's not an area that you delve into much?
So I do talk to my patients a lot about the possibility of using supplements just because I think they're becoming so popular. So it is important for patients to understand that they might have a mild positive effect in some cases, depending on which one you're taking. But we have to just remember that they are never going to have the same therapeutic impact that a medication would have,
Yeah.
right? So the as long as the expectations are realistic on these supplements, then I think that for the most part, if you're letting your doctor know that you're on these and they don't have anything against them, in terms of your medical history or other medications that it might interfere with, then it could potentially offer some benefit.
Okay. Doctor, we really appreciate you letting us know all about the what we need to know if you're considering a GLP-1, if you're microdosing, you're wondering if you should. Definitely, whether you're watching on YouTube or the podcast, like and share this episode with anyone so they can get this really important, credible information. We really appreciate your time today, Doctor.
Thank you so much for having me.
Shout out where people can find Pritikin.
In Miami, Florida, you can also find us online, Pritikin Longevity Center.
Okay, thank you so much, Doctor. And for
Thank
everyone
you.
for everyone watching or listening, have a great day and be well.